Hello, my name is Tom Villeneuve. I'm with Monadnock Retirement Solutions, and today I'm going to be talking about Medicare Advantage versus Medicare Supplement. Now, there are a lot of terms thrown around in the world of Medicare, so I'm going to try to make this as clear as I can. Medicare Advantage is also known as Part C. Now, Medicare Advantage plans do have an advantage. They offer additional services that may not be normally covered under your Medicare A and B and your supplement. Things like vision and dental. They also have silver sneakers and all these other things, gyms memberships if you live in the right area. They can be very good. The great thing about them is the cost out of pocket is very minimal. The cost out of pocket can be what you're paying currently for Medicare B. That cost will cover most of it. Sometimes there's a small charge, additional charge, which sounds great, but the deductibles are a little bit higher than your standard. Say an example might be supplement G plan. But you're getting these extras. So how do you know which ones you should do and which ones you don't do? Well, that is a great question. Here in the Northeast, people get Medicare Advantage if they like their current doctor and the doctor is covered by Medicare Advantage. You want to check that, make sure, or have someone check it for you. The other thing is, once you're on Medicare Advantage, depending on the state you're in, if your health issues come up, you won't be allowed to switch to a supplement. But there is big money savings. You have to fill up the deductible pool, which can be substantial. But it does come down to a mathematical equation. That's one part. The second part is whether your doctor's covered. And the third part is, do you mind having to get referrals to go from your doctor to a specialist? So the pros of using a Medicare Advantage plan would be you get one card from your Advantage plan insurance provider that would cover your medications. It would cover your doctor's visits. Many of them, like I said earlier, cover vision and dental. So they do require copays. They require coinsurance. Even when you buy drugs, medications, they'll cover that. You'll have to pay your small copays there. Now, overall, most people that have them are very, very happy with them. As I said earlier, the advantages are that it's one place to deal with. You have to be in network. So it's imperative your doctor and your specialists are in your network. That needs to be checked out. If you travel a lot, once you get out of network, your costs will go up. If you go out of the country, that's a whole nother thing. So the other disadvantage is once you go into it and you need to see a specialist, it needs prior authorization. You need a referral, as I've said earlier. So what if you want to go to a specialist in, say, Boston, and your network doesn't cover that? Well, then you're going to have to ask. And they might not let you. They may want you to go to one up in, say, Dartmouth, which is closer in network. So that's the big negative. With supplement, that doesn't happen. So that is a lot to think about. Medicare Advantage, Medicare Supplement with a Part D, or neither. I do sell Medicare Advantage and Medicare Supplement and can help you with either one of those or none at all. I'd just be happy to answer your questions. Please feel free to call me on the number here on the screen, and I'd be happy to answer your questions. Thank you.